you guys know, all of these webinars are recorded and put on both our website and YouTube channel. So if you need to leave in the middle for whatever reason, you can always access them at a later date at both of those places. And then as well, we'll probably put snippets up on our social media pages like Facebook and Instagram. So you can always get information, updates, and videos like this on our website and social media. I think that takes us to about 5 past. So why don't I get started with introducing Cari, and then she will start her presentation. So welcome everyone. Welcome to the Understanding Motor Symptoms and Their Effects webinar with Cari Cooke, physiotherapist. My name is Declan Beto. I work in client services for the Parkinson Association of Alberta, and I will be the moderator of this webinar. So if you have any questions during the webinar, please submit them in the chat box below. It should be sort of center of the bottom of your screen there if you're on a laptop. Yeah, at the bottom of your screen, there is a chat blurb icon. Click it and the chat will appear on the right-hand side. You can send your question out to the whole group or to just the panelists with the drop-down arrow. If you send it to the whole group, your name will be visible. And if you send it to just the panelists, then obviously we won't be saying your name when we ask the question. So just so that you know. Disclaimer, all information provided in the videos by Parkinson Association and the featured speaker is furnished strictly for educational and entertainment purposes only. This service is not intended to be diagnostic, prescriptive, or replace the relationship, advice, and or care of your physician or healthcare team. General questions about symptoms, treatments, available medications, complementary and alternative healthcare therapies, and current research will be fielded. So yeah, now to introduce Cari. Cari Cooke is a physical therapist who has spent the last 17 years working specifically with people with Parkinson's disease. She has gained unique experience as a deep brain stimulation coordinator, research assistant, clinician, and clinic owner. She currently consults for Parkinson Association of Alberta 3 days per week, running exercise physiotherapy classes, as well as individual assessments and treatments. Cari is certified in LSVT, big, power moves, and urban polling, and continues to learn from each client and family she meets. So welcome, Cari.
Thank you. And thanks to everybody who's taken the time to join in this morning. I hope that you find some new information or something beneficial to take away from. And if not, we can have a discussion at the end and answer any questions that you might have. So thanks to Parkinson Association of Alberta for asking me to do this talk today. They asked me specifically to talk about motor symptoms and their effects. And of course, since I'm giving the presentation, it will be from a physiotherapist perspective a little bit, but I have tried to incorporate a lot of the feedback that clients and patients and families have given me over the years about how that motor symptom really feels to them. You know, we can read the descriptors in a medical text, and it doesn't always describe what you as a person with Parkinson's is actually feeling. So I've tried to add in a lot of descriptors as well. And yeah, with that being said, I've been a physiotherapist for about 25 years this June. A lot of over the last decade with strictly Parkinson's clients in various capacities. So I see, you know, on a usual week when we're not in lockdown, I would see probably 15 people with Parkinson's during the week, sometimes more than once, even twice a week. It just depends. So, you know, probably over the last 15 years, I've seen over 100, maybe 200 clients with Parkinson's. So, just so you know what my background is there. So, okay, I fully admit to stealing this nice illustration from Indo Gulf Hospital in India. It was one of the best illustrations that I could find on the internet of some of the main motor features in Parkinson's disease. So going across here, bradykinesia, which can be seen in toe tapping, cogwheel rigidity, resting tremor, shuffling gait, mask-like expression, and postural instability. I will go over each of these in detail. And I actually have added 2 more at the end that are not in this illustration. So what is bradykinesia? It is a slowness of movement. So the person with Parkinson's, this can happen so slowly over time, so insidiously, that you may not notice that you're getting slower. But you may notice things like it takes a little longer to get dressed in the morning. Maybe before you were able to throw all your clothes on in 5 minutes and be done, and now it's taking 10 or 15 minutes. Sometimes people will notice a slightly slower walking speed. More so if they go on a regular walk with a spouse or a friend, suddenly it feels harder to kind of keep up. Like, why are they going so fast? You might even be asking them just to slow down a little bit. And it's actually not that they're going faster, it might be just that you're going a little slower. Or you might feel bradykinesia when you try to get up out of a chair, a low, soft sofa, or it might take you longer to get up, or it might take several tries to get up out of that chair. Also, some patients or clients complain of a feeling of weakness in a limb that's affected by Parkinson's. Could be an arm or a leg. There isn't actually true weakness at the beginning when people are diagnosed with Parkinson's. If we do manual muscle testing, we call it, the muscle is quite strong. It's just that it takes longer for the muscle to contract, and therefore it feels weaker to the person with Parkinson's. So how do we test for bradykinesia? There are several ways. If you go to a neurology appointment, they may get you to do something called finger tapping, which kind of looks like this. They'll get you to tap big and fast and try to keep you going. And what they're looking for is slowness. So how quickly the fingers are tapping. And if there's sort of an interruption of movement in there, they might also get you to do that with your heel, like heel tapping or toe tapping. In physiotherapy, we tend to do things like a 5-time sit to stand, which is exactly what it sounds like. We get you to stand up and sit down 5 times really fast, and we time it. And people who don't have a slowness of movement can usually complete that in around 10 seconds, let's say. If you have a lot of bradykinesia that you're trying to move through, or trying to move as quickly as you can, but you're still doing this test in 20, 30, 40 seconds, you have a fair bit of bradykinesia to move through. And we also do something called a timed up and go, which is where you sit in a chair, stand up, walk 3 meters, turn around, come back and sit down in the chair. And we time that. And a regular timed up and go would be about 8 to 10 seconds as well. If you take longer, if you take 14 seconds or more, you're considered to be at risk for increased risk for falling. But also it might be an indicator that there's some bradykinesia and slowness of movement in there. I'm not going to talk a lot today about medication. That's not my area of specialty. But there are medications for Parkinson's that can help this symptom quite a lot. And almost to the point where if you've had some slowness of movement, and you take the proper dosing of medications and the right kinds, your movement would be back to a normal speed. However, if you take too much medication, you can get some dyskinesias or too much movement. From my perspective, I'm always looking at ways that exercise can help with symptoms. So, of course, medication and exercise together gives you the best control over certain symptoms. And bradykinesia, the slowness of movement, can be helped out when you practice certain types of exercises. So I'm going to list off a bunch here. LSVT big, if you've ever heard of that, is specific types of exercises that were made by Dr. Becky Farley to address the speed and amplitude, or how big your movements are. Power exercises, also designed by Dr. Becky Farley, also address slowness of movement. Things like boxing, dancing, things that kind of force you to do things a little quicker. Treadmill training, there's self-cues, like counting and just telling yourself, I know that this needs to be a little faster. There are external cues that really seem to help with slowness of movement, things like music. Marching beats or very rhythmical beats can help people to move better. I'll have a client on a bicycle, for example, and walk into the room and turn music on, and suddenly they are going faster on the bike, and it's easier for them to do that faster than before I turned on the music. It could be something as simple as a metronome, which is just a steady beat that you can set at different speeds. Anybody who ever learned how to play the piano might be familiar with a metronome. There is an app for your smartphones nowadays called Clock Yourself, and it's designed specifically to help people increase their stepping speed. And it's quite handy for people to start off at a really easy level and then make it harder and harder and faster and faster. I think I'm going to show a video later about this Clock Yourself app to kind of explain what you would do with it and how it might help bradykinesia. The other thing is we sometimes do repeated training for specific functional tasks, and then we time them. So for example, a client might say, I'm having real difficulty putting my jacket on. And that is a really difficult task for some clients. So what we might do is take a look at how fast you're able to put your jacket on. I had a lady who spent over 2 minutes, got a little tangled up, a little frustrated, and wasn't able to actually put the jacket on at the end of the 2-minute time. So in therapy, we might work on things like stretches or range of motion to kind of loosen up the muscles. And we might break the task down into its key components. So really thinking ahead, like I need to put this sleeve in first, then this sleeve, and I flip it around myself this way. And in those ways, then we practice. And, you know, after maybe a 10 to 15-minute practice session, my lady could then put the jacket on in under 20 seconds. So it is very task specific if you want to improve something that you're having difficulty with. So, but bradykinesia can be addressed in all of those ways. So here's a little video about the Clock Yourself app. I think it's only a minute or two long, so just give you an idea what I'm talking about. Okay, so I'm just going to stop it there. You get the idea that it's a fairly variable app in that you can start off very simple and you can do it to match your abilities. The gentleman at the kitchen counter, for example, versus the lady on the bouncing Bosu ball for her steps. So it can be made quite difficult over time as you practice. And I have found that clients tend to get better at this over time. Particularly the cognitive aspect of kind of visualizing that clock and where do my feet need to go, and giving yourself that cue, okay, where is 8 o'clock and which foot do I need to get there? So it incorporates a lot of different components that we like to work on with Parkinson's disease. So again, and it's quite nominal in cost. I think that app cost me $3 or $4 to put on my phone, on my iPad. Okay, so moving away from bradykinesia, we'll move on to rigidity, and that is a stiffness or tightness of muscles, or said another way, the inability to relax muscles. This is from messages from your brain telling your muscles to tighten up. It's not you doing it consciously, and you may not even notice or feel this stiffness. What clients will say to me is that they first notice just a difficulty in moving their arms, say, above their head. They feel that there's maybe something wrong with the shoulder joint itself, and they've even gone for treatments to various practitioners for shoulder problems. Or they might notice that it's not swinging when they walk, but more often that's a friend or a spouse who alerts them the fact that their arm is not moving when they walk. You might notice a tripping. If your leg doesn't lift as high as you tell it to when you're walking, because of this stiffness or tightness in muscles, you might end up tripping over a step or a curb. You might just feel a little awkward rolling over in bed, and that can be stiffness or tightness in the trunk muscles. Or you might feel more of just an incoordination of things when you're trying to do up a zipper or buttons or put a lid on something. You know, the muscles just don't react the way that they used to because of this tightness, so you feel uncoordinated. Or you could feel a sensation of heaviness in that limb. When all those muscles are tight, you can imagine that that limb might feel a little heavier. Or even clients may have pain because of the tightness of the muscles. Let's say you have a little bit of a nerve impingement in your back from a previous back problem, and then the muscles in your back start to tighten up from Parkinson's disease. That can increase the pressure on that nerve and increase the pain. Or similarly in your shoulder, if you had a rotator cuff problem, maybe even to start with, and then those muscles around the shoulder start to tighten up from Parkinson's, it can make that impingement of that rotator cuff a little bit worse. So there can be pain associated with this tightness in the muscles. There are ways that I have found that reduce rigidity in addition to the medications, and that's repeated movements. So everybody's a little bit different, but for example, if you have arm rigidity, I might recommend we try an arm bike, like the gentleman on the left of your screen. He's got a very simple arm bike there. I get clients to try it forwards and backwards because backwards tends to loosen up the shoulder girdle a little bit better. We have a fancier machine at the Buchanan Center called a SciFit arm bike, which just is a little smoother and a little bit more resistance to it. But alternatively, if you have leg rigidity, you might loosen up your rigidity better by doing the recumbent bike, like the gentleman in the middle of the screen. Really works pelvis and hip and knee range of motion to loosen things up. It can be as small as 5 minutes on the bike. That might loosen up that stiffness in the leg, and it might take a longer period of time, 20 minutes or longer. Each person is very individual, so as a physiotherapist, I take time to try to figure out which activities causes the most reduction in rigidity for you. You'll notice it as it just feels easier to move. The people on the right side of the screen there, that's a class of clients that they're practicing repeated drumming movements. So very large, very upright posture type, but repeated movements at the upper extremity and stepping at the same time, and that might loosen up some rigidity. The lady in the background on the left is on the treadmill. That works better for some people than the bike. So a 20-minute walk or a 40-minute walk might loosen up your arms, your legs, and your trunk better than any of the other activities. So it's quite individual. And I do recommend people take the time when they are exercising to try to figure out which exercises make you feel looser or better or easier to move. And that means you're affecting your rigidity. You know, it might be something like yoga for you. It might be Tai Chi, it might be water exercise. If you're afraid of the water, it's probably not water exercise for you. You don't want something that's going to tighten you up and make you anxious. You want something that's going to make you feel good. So moving on to tremor. In Parkinson's, it's categorized as a resting tremor, which is a rhythmical, involuntary, oscillatory movement of a body part. They say it's about a 4 to 6 hertz frequency at rest. They might also have heard it called a pill rolling tremor. It kind of looks like if you were to be shaking some pills in your hand or rolling them around in your hand like so. The tremor can be in one hand or one leg. It could be in both. It can be intermittent or it can be constant. So it varies over the course of the disease and over time, and even in one day. It might get worse with stress or excitement or anxiety, or even if you're fighting a cold or a virus, the tremor can worsen temporarily, and then it will go back to its normal resting state. By worse, I mean it can be a little faster, be a little bit bigger. That's what I mean by worse. And it might disappear altogether when your hand is active or moving, because it's more at rest. If you go to grab a pen and start writing, that tremor might go away completely. And it might still be there a little bit. There's a little crossover between resting and active tremors. But not everybody has a tremor. It's what people tend to think of when they think of Parkinson's, but it's probably present in about 60 to 75% of people with Parkinson's, but not for sure. Not everybody has it. There's what we call subtypes of Parkinsonism, and there's a tremor dominant subtype, and there's also called an akinetic rigid subtype. We'll move on to that here. The good news is that if you do have a tremor dominant subtype, some studies do suggest it is linked to a slower progression of the disease. You might have less severe motor, cognitive, and functional disability compared to somebody who has primarily an akinetic rigid subtype. Treatment, I will say that medication has a variable and sometimes no effect on tremor. For some people, the medication makes the tremor go away completely. So it's very individual. And some people with Parkinson's do report a reduction in tremor with relaxing things like deep breathing, relaxation, and mindfulness exercises. So if that's something that you've tried in the past and has worked for you, and it's a particularly bad day for your tremor, you might just want to take a few minutes and practice your deep breathing. What I do want to say about tremor, although we don't have a lot of great treatments for it, is that what can happen over time is, especially if the tremor is in your dominant hand, for example, you might start not using that hand as much as you used to. And you might start doing things with your other hand just to make life easier, which is totally understandable. But you're at risk to have some decreased strength in that hand or that limb if you're not using it as much as you used to. You've heard the phrase, if you don't use it, you lose it. So what I do recommend to people is that you take time to practice specific tasks with that tremor side and specific exercise training so that you can maintain your strength and dexterity and coordination with that side. A lot of clients will say to me, oh yes, I don't write anymore. My husband signs all the checks, or my wife does all the birthday card or Christmas card writing. And I say no to that. We practice in my classes handwriting. It might be a little frustrating, it might take a little longer, but it is worth your time and practice for many reasons to maintain function in that hand. For the last several years, I have used this app on my phone. It's called Calm, and it is just a way to teach people how to deep breathe, how to do some body scan meditations. It also has just calming, soothing music on it. It also has sleep stories that if you're somebody that needs a little help to fall asleep, or if you wake up in the middle of the night and you need something calming to listen to while you're trying to get back to sleep. So there are many aspects to this app that I have found useful with clients over time. This one's a bit more expensive. I think you get a free trial for a certain amount of time. And then I think I pay about $70 a year for all the features of this app. I still think that is cheaper than lots of other types of treatments out there. And I can access this every day, several times a day if I need to. All right, postural instability or impaired balance. Clients will often say to me that they are noticing that their balance isn't as good as it used to be, even at very first diagnosis. They will say that they feel unsteady, especially with more difficult things like turns, walking up and down slopes. They may have even had a few falls. And you might notice things like you have to sit down on your bed to put your pants on in the morning instead of putting your pants on standing up. So how we test for that? The neurologist will often do a pull test, where they kind of pull you backwards quite forcefully, and they see if you can step and catch yourself. And you may be able to take one step and catch yourself, and that's a certain rating, or you might have to take several steps backwards to catch yourself. Or you might not even be able to step at all and you just fall over like a log. That's a different, that's a worsening on their test. As a physiotherapist, we use things like the Bird Balance test, a dynamic step gait index, or a single leg stance test to kind of see where you're at in terms of your balance. Balance has, the ability to stay steady and still, but also move. So there's two different kind of components to balance. Some of the treatments we recommend, aquatic therapy, actually, research studies show that it can help prevent falls. So obviously works on balance in some way. Tai Chi, dance. In physio, we do get down on the floor. We do a lot of core exercises. We might practice crawling forward and backward to engage those really large muscles around the pelvis and shoulder. And your abs. We do a lot of stepping and reaching and turning practice in different situations. We like to strengthen a lot of our core muscles. We do some stop-start training. In Parkinson's, that might be a difficulty for you, is that you can get going, but you can't stop yourself very quickly. Or once you're stopped, you can't get going very good again. So we practice those things. Yoga also has a lot of balance components or obstacle course practice. Many different ways that we can work or address postural instability. Shuffling gait, but actually gait is my favorite thing to work on with people. So shuffling gait is a walking with short and flattened steps. You might notice that you're walking a little slower. That's due to the shorter steps. You might notice just increased fatigue, or you can't walk as far as you used to. You might notice the no arm swing, and you might notice that you're always looking down at the floor when you're walking. You're not gazing up ahead and sort of reacting to what's coming up. You're always looking kind of straight down. That's a shuffling gait. And some of the tests we do for that, a 7-meter walk with a turn is used in research quite a bit. Again, the timed up and go. I like the 10-meter walking velocity or the speed, because I know that if you can walk at 1.0 meters per second or faster, you can cross a street light before it turns on you and you get caught in traffic. Sometimes we do a 6-minute walk test just to see how far you can go in 6 minutes. Of course, the slower and more shuffling you walk, the less distance you'll be able to cover in that 6 minutes. And one of my favorites lately is a 3-meter backward walk. It has been shown that if we practice backward walking, we can actually really improve our forward walking in terms of speed and stride length. We also do something called heel walking, which is just to see if you can control your balance while you walk on your heel. It's not very functional, but so for treating gait, lots of different ideas. Visual cues you may have seen with lines on the floor or stepping over obstacles. Just telling people to swing their arms more or take a bigger step works often quite well. We might actually physically swing that arm while they're walking to kind of show them what a good arm swing or a normal arm swing feels like. There's treadmill training and pole or Nordic walking. We practice backwards walking, sidestepping, crossovers, obstacle courses. We might recommend a gait aid like a walker or poles. We like to improve people's endurance if that's important to them, to be able to go walking out at the mall. Postural correction, LSVT big, all sorts of therapies. The one that is new on the list here is a wearable. So for example, I wear a Fitbit every day to count the number of steps that I've taken. And so always looking to make sure that I haven't sat too much that day. Just one note for Parkinson's, if you're wearing it on the arm that doesn't tend to swing, you will get shortchanged in your steps. It won't record it very well if you're not moving that arm. So try to wear your wearable. If your goal is to swing that arm more, wear it on the arm that doesn't like to swing. If your goal is to actually get accurate step count, wear it on the other arm. So I have a video here of a lady who has Parkinson's disease. On the left side of your screen, she is walking without walking poles. You'll notice a shorter step length, a slower speed. And then on the right, she's walking with poles. You might notice her posture is a little bit better. Her arms are certainly moving more, and her step length and speed are a little better. So just have a look. I'll try to be quiet. It's a lot to look at the same time. Maybe look at the left first. You can see none of the arms on the left are moving. So that was really fast. But that might give you an idea of some changes, positive changes that can happen with practicing walking. Another motor symptom is mask-like expression or hypotonia. So person with Parkinson's or family or friends might notice a reduced facial expression. Often it's just a very flat expression. There's less spontaneous smiling that occurs, even though the person thinks they're smiling. It may not reach to the muscles of the face. The lips might be parted some or most of the time. They might hang open a little bit. That can lead to some drooling. There might be reduced blinking frequency or dry eyes. You might notice that it's just a little slower. And also the hypotonia is a reduced voice volume. It might be low to hear, or it might be just more mumbling, depending on if the muscles around the mouth are coordinating, or if there's some rigidity in those muscles. People might be asking you to repeat yourself, and you think you've spoken quite clearly. Talking on the phone might be challenging, and there might be some swallowing difficulties, so you may choke on water or dry food or pills. So that's a lot. That's the mask expression, the low voice, and the swallowing difficulties. Certainly there are tests that mostly speech therapists will use when talking about improving your speech when swallowing. They have measurements, machines that measure the decibels of how you're speaking. There are also some of those for your smartphone that will tell you how loud your speech is. So when I use it, my speech is around 90 decibels. If it's lower than that, people find it harder to hear. If I'm shouting or singing really loud, it might be over 100. So you can find those on your phone for free, usually. Speech therapists will also do swallowing assessments, barium swallows, which is an X-ray that they take while you're swallowing some barium, so they can see how the muscles of your mouth and throat are coordinating to whether or not you're swallowing safely. And doctors like to use a rating scale called the UPDRS to rate things like speech and expression. Treatments, of course, speech therapists are a great use to help with things like LSBT loud, so learning how to speak louder or using more breath through your vocal cords and singing. As a physiotherapist, we definitely practice different facial expressions in front of the mirror. So in my class, we get used to doing things like a surprised eyebrows. I don't know if you can see, my eyebrows are trying to lift up. Or concerned, the eyebrows kind of come together and you get a bunch of those wrinkles. So if you practice in front of a mirror, you'll be able to see if what you're feeling on the inside is actually being reflected on the outside. Because a lot of our communication with our family and friends is nonverbal. So if they're talking to you and your face is not moving, they might not know whether you've heard them, whether you've understood them, whether you agree, or maybe you might even look like you're mad at them. So you want to make sure that you're getting as much facial expression as you can. I think it's also functional to practice opening up your mouth really wide. Like when you go to the dentist. Sometimes people will lose the height. They won't be able to open their mouth as wide as they used to. And so that's from stiffness and rigidity of the muscles all around in the face. So you can also try facial muscle massage. You can take your fingertips and kind of just loosen things up. But also just the sensation, like what do I feel? If one side is not lifting, give it a little nudge and see if you can get it to go. I think breathing exercises are extremely helpful. You certainly might get those in speech therapy as well. So practicing taking large breaths in and forceful breaths out, or long, slow breaths out. Depending on how you breathe in and out, depends on how things go through your vocal cords. I think that one of the best treatments for this symptom is probably social interaction. So if right now it's not a great time because we're all at home a lot, but as much as you can to try to talk to people, interact with them, it will force you to use those facial muscles. All right. And the other one that I added that the first slide of the presentation did not have is micrographia. It's small handwriting. So here's an example that I give credit to Helen Ling as a researcher, and she published this in an article that shows, this is very typical of what I see. Clients' writing may start off a little better at the start of the sentence, but then it gets smaller and smaller and smaller by the end of the sentence. And so the top one here is when they're not on any medication for Parkinson's. So it's very tiny, hardly even able to read what that says. And then down below, they've written it again, but now they have their medication in their system and working. So it's certainly a lot bigger. And it doesn't tend to get smaller and smaller as the sentence goes on. So there, we practice this in my class a lot. I also find that doing this after exercises, when you've been focusing and attending to your movements and making them larger throughout the exercise class, then it transfers over to your handwriting. So your handwriting after you've done the exercises is better. All right, and that's the end for me. Is there any questions?
Great, thank you so much,
my lovely
Cari.
client here working on a recumbent stepper machine.
Oh, here we've got one question. I experience rigidity in the toes on my affected side, leading to pain with every step. Due to my foot structure, 3 toes on this foot are hammered, adding to the problem. Are there specific exercises you would recommend?
the toes can cramp up like that, and that can be something more than just rigidity. It can be something called dystonia. And if that is present, it's signals from your brain that are constantly telling your toe muscles to curl like this. And you're absolutely right, it can be quite painful to walk on. Over the years, I've tried many different things. I will say the most effective treatment may come from your neurologist. Sometimes if that dystonia is quite big, they will do Botox injections to the toe muscles to have them relax. So I am not a neurologist and I can't really speak to that, but I have had patients have very good success with Botox injections into the toes. Some clients will get shoes with enough space for orthotics to be put in. The variable results with that. The other thing is just specifically spending some time focusing on foot muscle exercises. So making sure you're getting a stretch, making sure you're getting those muscles activated in the toes. Often if there's pain and we don't move the foot properly when we're walking, we need to make sure we're getting that motion when we're doing specific foot exercises. So I think you could definitely go to see a physiotherapist and get specific foot exercises for that. So one of my favorite ones is just putting a towel on the floor and spreading your toes out really wide and grabbing the towel and trying to bring that towel all the way and crunch it up underneath your feet all the way towards you. That's just an example of one type of exercise. In my class, we also will practice landing on our heel. So even in a sitting in a chair, just putting your heel on the ground with your toes up. I don't know if I can move my camera so you can see my feet, but heel on the ground, toes up. Practice putting weight through that heel and then slowly lowering the foot and rolling over so you push off on the toes. That is the normal walking pattern. That's what we'd like to see during every step of your gait. So if you can even practice that in sitting, just to see if your foot actually does that. So heel to toe, and then see what happens with your toes at each point of that stance phase, we call it. And you might be able to pinpoint a certain part of the toes that needs stretching out. So it's certainly worth consulting with a physio in your area to see if you can get some specific foot exercises or chatting with your neurologist about the Botox.
Great, thank you. Any other questions? You can send them in the chat below. I've got one while we wait. You touched briefly on gait aids. When do you know if it's time to use a gait aid like a cane or a walker?
Well, very personal. Many clients, I have to say, over the years are quite reluctant to use a gait aid. And in Parkinson's, we want to see that arm swing. So if you put somebody on a walker and their arms are constantly on the walker, they're not going to get that good arm swing. So I'm fairly reluctant to use a walker unless their balance is absolutely, for safety reasons, it's necessary to use the walker. The reason why the arm swing is so important is that it gives you that counter rotation between your lower and your upper body, and that gives you momentum. So what momentum gives you is it's less effortful to walk. So walking with a walker, although can be safer, it's a little more effortful to walk. Also, people tend to bend forward and stoop and push the walker as if it were a very heavy lawnmower or grocery cart. And we're trying to get people's posture not to be bent over. So there are some detriments to using a walker, but certainly if your balance score and your fall history were indicative to me that for safety reasons you needed that walker, I would recommend it. Also, people just functionally out in the community, it's a place to sit. So the second that you feel really tired, maybe you're having a freezing episode, you don't have to look for a place to rest, right? You have a built-in chair. essentially there. So maybe you use the walker only when you go out to the mall, or only when you go for long walks out in your neighborhood and there are no chairs to sit and rest in, right? That might be a time where you can use the walker. And if your balance is being supported by the walker, you can tend to take a little longer step length and feel safer to do that. I also love the walking poles. Being an urban poling instructor and trying it with many, many clients now, it sometimes gives just enough stability to keep people safe because they have that 4 legs on the ground, so to speak, and they have that feedback, but it also allows for the arm swing that we want, that can give you that momentum that we're looking for.
Great.
So it is individual.
Mm-hmm. Yeah, thank you.
You're welcome.
Can you please tell us again the name of the stepping app? That should be a quick one.
Clock Yourself.
Clock Yourself. Okay.
Yeah.
So that's Clock Yourself. And could you speak on freezing a little bit?
So early on, when people are diagnosed, they don't often have freezing right off the bat. It is something that seems to come on as the disease progresses. Some people will have they only freeze when their medications are wearing off. So that can be fixed a little bit with changing your medication with your neurologist. Maybe you change the timing or the dosage of your medication. But as the disease progresses even further, sometimes the freezing happens even when your medications are working perfectly and they're on. So on-time freezing. So there are certainly tricks clients have taught me over the years that if they are freezing, that helps them to get out of that freeze. So anxiety makes freezing worse. That can be cognitive anxiety, emotional anxiety. So often what we do is we just stop trying to walk altogether. We stand up straight and we take a deep breath in. The breath, people tend to hold their breath as they feel the freeze coming on. They start to get a little anxious, they hold their breath, and it just makes the freeze continue. So if you can stop, stand up straight, take a deep breath in, sometimes that alone is enough to break the freeze. Sometimes you need a little bit more. So after you've done that and you've taken your breath, for some people, they prefer to kind of rock side to side to see if they're getting any weight shift happening before they try to lift a leg. Some clients will snap their fingers, something completely different than trying to walk. Your brain is now triggered onto something completely different. Then you go back to, okay, can my foot move forward? It sort of breaks the freeze. Even something simple like bending over to pet your cat. And now you're thinking about the cat and you're not thinking about walking. There's something in the brain that sort of just releases with that. So some clients say they even will take a step backwards instead of forwards. Seems to break it. But honestly, the most often is that stopping, standing up straight, taking a deep breath, then cueing yourself to take a really large starting step.
Awesome, thank you. Yeah, we've got a couple more. Do you have time here for a couple more?
I sure do. Please.
Okay, awesome. This one, good morning, Cari. We enjoyed your presentation and we miss our exercise classes. What is the most important exercise we can do at home?
Oh, goodness, the most important. Well, that's a tricky question, isn't it? I guess I would probably answer getting your cardiovascular exercise in might be one of the most important things you can do at home. So if you have one of those little handheld bikes that I showed in one of the photos, I would use that on your legs. I would do another session later in the day with your arms. It keeps the whole body moving from a muscle perspective, but it's also good for your heart, your lungs, your circulation. Cardiovascular exercise, especially if it's intense, has been shown to have some potential to slow the progression of the disease. So intense cardiovascular exercise is really being pushed A lot of research has been going into that, and even if you can't get quite as intense as you'd like, there's still benefit to doing a moderate or low intensity cardio exercise as well. So of course there are many different types of exercises, from stretching to strengthening to cardio to walking practice. Yeah, I guess I would pick cardio if I had to, but I like them all.
Thank you. Another one here, well, two more, but we'll do this one first. You presented mask-like expression and hypotonia together. Do they usually exist together? If you have one, do you have the other?
Oh, that's a good question. No, not necessarily. I think I only kind of lumped them together in that I think of them as being kind of face and throat orientated, but you can definitely have low voice volume quite early on without the mask expression, or vice versa. I don't think that there's a correlation that I'm aware of that the two go hand in hand. They are separate symptoms. So very good question.
Great, thank you. And then the last one, I was hoping that they would elaborate a little bit here, but that's okay, I'll ask it as is. So the question was dominant side, how to treat. So I'm assuming that means if your disease or motor symptoms are more prominent on one side, how do you work with that?
That's a very good question as well. So idiopathic Parkinson's disease is typically asymmetrical. So one side is more affected than the other, especially at diagnosis. Over time, both sides can have the rigidity, the bradykinesia. It becomes a little bit more symmetrical for some people. But I think it is very important to try to make the body as symmetrical as possible. So if you have a lot of rigidity and stiffness and lack of range of motion on one side of your body, you may spend more time focusing on exercises on that side. But of course, both sides of the body need to work together for most functional activities. So you may spend some time doing total body movements on both sides. And so even, for example, the lady who's on the recumbent stepper in the photo here, it's both arms, both legs, all four limbs working at one time reciprocally. So one pushes while one relaxes. And that is very, very helpful to work both sides of the body. So trying to gain that symmetry. So the treadmill also, because it walks at a constant speed, what happens with asymmetry in the legs is one leg will walk faster and one will be slower. And that will kind of make sort of a interesting gait pattern. But it's harder to do that when you're on a treadmill because it's going at a constant speed. You try to become more symmetrical. So that's one of the benefits of treadmill training, is that you have that symmetry sort of, it's pushing you to try to keep those step lengths the same. Versus real life, walking over ground, you can really pander to that asymmetry.
Great, thank you. That was the last question from clients. We'll give it another 2 or 3 minutes if there's any last questions. But I'll do my outro right now, and then if anything comes in during that, we can jump back.
Can I say one more thing, Declan? This whole talk was on motor symptoms, but I by no means want to belittle the fact that non-motor symptoms are really important to clients. In fact, for quality of life, it's the non-motor symptoms that sometimes are worse for people. So I don't know if you have another webinar coming up at some point, or people can look up on the internet about non-motor symptoms, because as a physio, I know I'm a little bit narrow in my field of view, just looking at motor things, but those non-motor problems are very, very important to clients.
Mm-hmm. Yeah, thank you for saying that, for sure. For sure. Yeah, so thank you so much for being here, Cari, and being able to join us today for this webinar on understanding motor symptoms and their effects and sharing your knowledge. We really appreciate it. Thank you to everyone for joining us, and our next webinar date is May 20th. We're already into the middle of May. I can't believe it. Wow. Our next scheduled webinar is Staying Mentally Healthy During Stressful Times, And for more information on the Parkinson Association of Alberta, please visit our website, parkinsonassociation.ca, or follow us on social media. All of these webinar events are promoted on our Facebook page under our events category, as well as being put on our YouTube channel and website after the fact. So yeah, just so that you guys know, we are trying to do as much as we can for our clients during this sort of lockdown time. And I know that all the clients really appreciated you coming out today, Cari, because we got so many questions post presentation. So yeah, I know that they appreciate you being here. So
Well,
thank you so much. Yeah. No other questions came in, so we'll end it there. Thank you.
Okay. Bye, everyone.
Bye-bye.